And as we approach the end of a challenging year, there is hope. More resources are opening up that will help us move through and past the pandemic. One of those resources is the new antibody treatment. It's an outpatient treatment now being offered at Midland Memorial Hospital. It opened up last week, but not many people are showing up to get it. Close to a dozen spots are being wasted a day. Doctors tell Sammy Steele they have an idea about why that is. Sammy?
Tatum, the hospital has a few hundred vials of the COVID-19 antibody treatment. That's more than initially expected. But the hospital is not treating as many people as they hoped. That's because only about 3 people a day are signing up for it. Until now, treatments for COVID-19 were reserved for the most sick and the most vulnerable. A new antibody treatment that does not require a hospital stay is now being offered by the hospital. The treatment is given through an IV and takes about 3 hours.
Like I said, it's neutralizing antibody. So this targets the virus, and then it allows your own immune system to kind of clear it. It's sort of like a flag that says this is an invader. Come take it away, destroy it.
There's a small window of time for this to work properly, only 4 days after symptoms or a positive COVID test.
You have 2 phases. So the second phase is an inflammatory phase, and having an antiviral, which the monoclonal is, on board during the inflammatory phase isn't very helpful. So the inflammatory phase is usually what you see later. You have the viral phase for about 7 to 10 days. And then usually you make antibodies, clear the virus, you feel better, go on your way.
But that can only happen if people get the treatment. Getting patients at the right time has proved to be pretty tricky.
So once the patient arrives, that's when we start to thaw the product out. So there's a little bit of waiting before you receive it, but that's to make sure it's not wasted. So we don't want to waste it, but at the same time, we don't want to waste the spot. We've got ability to treat you. We're going to get some more. We don't want patients staying home, getting sick, that we otherwise could potentially keep them out of the hospital.
Dr. Klingensmith tells me 25 people have received this treatment, and they started to feel better right away, and their symptoms, they didn't get as severe. Now, again, strict details on who's eligible. You must have pre-existing conditions, be 65 years or older, and have a doctor referral. And the biggest thing here, you have to be treated within a certain time window, 4 days from your onset of symptoms or from your positive COVID-19 test. Reporting in Midland, I'm Sammy Steele. Back to you, Tatum.